everyone. This is Toni Kettner with the Lake Superior Quality Innovation Network, or Lake Superior QUIN. The Lake Superior QUIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicaid and Medicare Services Quality Improvement Organization program. I'd like to welcome you to call number 5 of our Introduction to Infection Prevention and Control Open Call series, entitled Common Citations, What Are We Missing? It's my pleasure to introduce today's speaker, Diane Dome. Diane Dome is a nursing home project specialist with Medistar Incorporated and currently assisting Wisconsin long-term care facilities with enrollment in the National Healthcare Safety Network, or NHSN, reduction of C. difficile infection, antibiotic stewardship, and infection prevention and control. Diane is a certified medical laboratory technologist who has a bachelor's degree in business and has been board certified in infection prevention and control since 2008. Diane is also a certified professional in healthcare quality. And with that, Diane, I'll turn it over to you.
Thank you, Toni. So this series is really meant for the beginner infection preventionist or as a good review for your more experienced IP. We're going to be talking at a very high level, an overview of the basics. We really don't have the time to get into all the details, but I'm hoping that you'll find this as well as the resources listed at the end of the PowerPoint helpful to you. These calls are not meant to be a substitute for what CMS has coined completing specialized training in infection prevention and control as required in Phase 3 of the final rule. The CMS and CDC did release a memo on March 16th stating that they will be offering a specialized training course in the spring of 2019. This will be free of charge, available online, available on demand. They expect the training to take approximately 16 to 20 hours, and a certificate of completion will be provided. Completion of that course will provide what they deem specialized training in infection prevention and control. So we look forward to that training and we'll certainly alert you when that is released. In the meantime, we're going to continue with our series. As you know, you can ask questions and answers in the chat box. We'll also open up the line at the end of the presentation for calls as well. Our objectives today: a discussion of common infection prevention and control program citations, which typically fall under F880 or possibly F881. I want to recognize some of the trends that are occurring in these citations, talk a little bit about the new survey process, and discuss tools and strategies for prevention of those citations. So the new survey process started in November of 2017, and there are some differences in how the process works compared to how it used to. The surveyors now go right to the floor. They don't have a lot of meetings prior to going out to the floor as they used to. Your staff is not required to accompany the surveyors. It is much more computerized. You will see the surveyors carrying their tablets and putting the information directly into them. And they will interview all residents possible to get a better picture, really, of the status of what's going on at your nursing home. We're going to talk today, really, about how that survey process is related to the Infection Prevention and Control Program. One surveyor is really the lead for the infection prevention component and will evaluate the program listed here. They're going to look at your overall program, review the policies and procedures, look at your surveillance program, review your antibiotic stewardship program, look at how you're tracking and providing influenza and pneumococcal immunizations for residents. And besides the lead person with the Infection Prevention and Control Program, there's also going to be a team assignment for the team that will include somebody looking at your laundry services, resident on transmission-based precautions, as well as 5 sampled residents, again, for that influenza pneumococcal immunization, and they will be doing other care-specific observations. Please remember that every survey is assessing infection prevention and control compliance as they are throughout your building. So the surveyors are using a tool provided by CMS called the Critical Element Pathway. This is really your best blueprint to prepare for that survey. You want to use this as a checklist, just like they will, to review the facility practices for each section, and each section is then scored with a yes or a no. A no will equal a citation. So you have this tool very accessible to you. There'll be a link to it at the end of the presentation. I would suggest that you look at that critical element pathway and really will provide your checklist to prepare. We're going to run through the critical element pathway for infection prevention and control program. It is divided into sections, 8 sections, and we'll briefly review each one. Now, you'll notice that many of these things we've discussed on previous calls, so refer back to those slides and those recordings, which will be on our website as well. So starting off on the critical element pathway, the first section is hand hygiene, so both with alcohol-based hand gel, soap and water, prior to donning gloves and after removing gloves, one of the things that they notice probably not being done the most often. The use of personal protective equipment or PPE, including gloves, gown, face mask, face shield, as indicated by the type of transmission-based precautions or the type of symptoms that that resident is showing. If they are in transmission-based precautions, they will be checking to see that the appropriate precautions are implemented. Whether dedicated or disposable equipment is used for those residents whenever possible, and that it be cleaned if it is not dedicated or it's not disposable. That equipment needs to be cleaned, appropriately disinfected before it is used on another resident. The next sections in that critical element pathway will include laundry services, nothing new there. We're going to look at how you handle, store, and transport your linen. They're going to look at how you do infection surveillance. Is your plan based on your facility assessment? Again, that facility assessment was required as part of the earlier phases. That should have been completed, and that should really drive your program and the types of surveillance that you're doing. You want to focus on early detection of that infectious resident to prevent transmission to the other residents. Are you using evidence-based criteria such as McGear definitions? We're also going to be looking at analysis of your data. So it's not enough to just collect that data, but what do you do with that data? How is it being evaluated? What actions is it leading you to for improvement? They're going to check to make sure that you know which reportable diseases and the time frame that they need to be reported to the Division of Public Health. And if concerns are identified and reported, how have you acted on them? That is all part of that surveillance portion of the critical element pathway. Another section in that pathway will deal with antibiotic stewardship program. They'll have your antibiotic use protocols that they'll review, protocols to review signs, symptoms, laboratory reports to see if that antibiotic was appropriately prescribed and indicated. Do you do a periodic review of your antibiotic use? Do you have a system for feedback to your providers? All part of the review of that antibiotic stewardship program. Again, we mentioned that they are going to look at 5 specific resident records for influenza and pneumococcal immunization. As with any portion of the critical element pathway, if they notice that things weren't done appropriately, they may look at more than 5 residents. So when we talk about the critical element pathway in those 8 sections, and we mentioned that a yes means that you're compliant, and no means that you didn't fulfill the requirements of that portion of the critical element pathway, and we're going to talk today about some of the most common citations within the infection prevention and control critical element pathway. So it states that infection prevention and control program citations are some of the most frequent citations that there are. Infection control programs must be designed to prevent the development and control the spread of infections. is the number two, or was the number two most frequently cited citation in 2016 and 17. Not much different this year with the new survey. And these rankings that I'm really talking about here are aggregate of Michigan, Minnesota, and Wisconsin data, as well as kind of comparing it nationally. There's not a lot of difference from state to state or nationally. We're all kind of in the same boat. Typically, your infection prevention and control program citations do not reach the immediate jeopardy level, and they will typically fall under the 880 FTAG or the 881, which is the antibiotic stewardship portion. And prior to November of 2017, you knew these as the F441 tags. What are some of the most common citations? So we're going to talk, I kind of picked out the 5 most common ones that we see. We're going to talk about each of those separately: hand hygiene, outbreak management, transmission-based precautions and use of personal protective equipment, surveillance, and then rounding out that top 5 list with cleaning and disinfection. So hand hygiene really amounts to about a third of the citations. Some of the most common ones: failure to wash your hands or change your gloves during personal cares or during treatment. Sometimes our staff thinks that once they put gloves on, they're just like good forever. We have to really teach our staff that you need to change those gloves at the appropriate times, always doing your hand hygiene before and after. And we've trained our staff to clean their hands minimally, before and after contact with the residents. But you really need to make sure that you're focusing on the World Health Organization's 5 moments for hand hygiene. And these include before touching the resident, before a clean or aseptic procedure, after a body fluid or exposure risk, after touching the resident, and after touching the resident's surroundings. And there is a link to that resource at the end of this presentation, so don't feel like you have to jot those all back down. And again, each surveyor will be observing hand hygiene the entire time that they're in your facility. And these 5 moments are really what the surveyors are using as their guide. So again, with failure to wash hands or change gloves, also specifically a lot of citations for failure to wash hands during medication administration, and also residents not being offered hand washing before meals or after personal care. So it isn't just our staff we have to be concerned about. Moving on to outbreak management, and again we discussed this in call number 3. Some of the most common citations is the line list that you keep during an outbreak being inaccurate or incomplete. During an outbreak, when did the symptoms start and end, and the staff symptom resolution and return to work dates are probably the most common pieces of that line list that typically are incomplete. Timely identification of the onset of the outbreak. So thinking about your process, again, as we talked about in call 3, you want to make sure that you're really looking at the entire building versus just one neighborhood. Are you making sure that you're taking staff illness into account as well as resident illness? And who can pull that trigger? And if it's one of your key people, what happens when those key people are not in the facility? Also, the post-outbreak facility debrief. So this is what you do after the outbreak ends. And again, we talked about that. It's really a debrief of what happened, how did you respond, which is the summary of actions that were taken, what worked well, what worked according to your plan, and what did you really discover that you need to change for next time. And this is really your chance, as one surveyor put it to me, find it, fix it, and get it to pass non-compliant, so that when they're coming in your building, you can show them that you identified a problem and you fixed that problem. Another common citation, transmission-based precautions and use of personal protective equipment or PPE. We talked about transmission-based precautions in our last call. And again, a point is that you want to make sure that all the residents, even those when you identify those that need transmission-based precautions, but that you're evaluating them as soon as they have symptoms. You want to make sure that they will be on your infection control log, and that you're, as we talked about, your outbreak line list, the date of symptoms, the date that transmission precautions were started. Do you have adequate supplies of personal protective equipment? Is your signage appropriate and correct to the situation? Has the staff been trained in donning and doffing, putting the personal protective equipment on and taking it off? And how do you determine when a resident is placed in transmission-based precautions? Where are you documenting that evaluation, as well as when you determine that they can come out of transmission-based precautions? Your surveillance, another top citation. Two of the most common things is not calculating your rates of infections or analyzing your trends. We talked about surveillance and data analysis in calls 1 and 2. Remember that your infection rate is really the number of infections divided by the residents at risk. That may be the total number of resident days if you're talking about, say, GI illness or respiratory illness. If it's catheter-related UTIs, it would be the number of residents that have a urinary catheter. And you really want to make sure that you're using the number of resident days. I do find occasionally that facilities are using an average census for the month, times 30 days. And while you think that may be close, they really want to see that you're paying attention to the total number of resident days when you're calculating your infection rates. Most likely someone in your billing office or your medical records department has that data for you. You likely do not have to keep track of that yourself. Again, your line list of infections should include all symptomatic residents, not just those who were placed on antibiotics or those that did have a positive test or a culture. They really get that infection log list when they become symptomatic, and that's those that you are evaluating, all residents that are symptomatic. And we mentioned analyzing that data. We talked about that in a previous call. What is your data saying to you? What is it telling you that you need to improve? What kind of trends are you seeing? The surveyor wants to know that not only are you collecting that data, but that you are using it appropriately. Rounding out the top 5 is cleaning and disinfection. Some of the top citations: not placing a barrier between surface and equipment. So when you're bringing something into a resident's room, such as a piece of equipment or a glucometer, you don't want to place it on the over bed table without a barrier, not on the resident's bed or the resident's chair. Another high area of citations relates to the glucometer not being disinfected appropriately between uses, as well as contaminations of medications during the med pass. Do you watch your medication preparation and distribution? Do you do any kind of audits? So when you think about those top 5 areas of citations, how do we really prevent them from becoming a citation? We talked about using that critical element pathway as kind of a checklist, if you will, to review your process. But you really want to make sure that you know how well you're doing. And the way to do that is really to audit your compliance with your practices and procedures. You want to, at a minimum, audit your hand hygiene. When you have a resident on transmission-based precaution, you want to be looking at whether your staff is using the personal protective equipment appropriately. You need to monitor your cleaning and disinfection as well. So think about, when you're talking about your auditing process, how many observations are you doing in your facility? Obviously, the more observations you do, you have a better picture of really what your compliance really is and what the surveyors may actually see as they are within your facility. Are you the only one doing that audit, or can you list other staff? Some facilities have had great luck using charge nurses or other passionate staff, but just a caution that you do want to make sure that everyone involved in auditing compliance has been trained to evaluate it the same way. That will keep your data consistent and valid. trying to do these audits, and you all have many, many things on your plate, and there is an extra time in a day to do it. But think about, as you are already out on the floor, you can be observing the majority of these things. When you're making rounds, when you're going to huddles, etc., try and make it be part of your daily workflow so that it doesn't become an additional burden that you have to try and carve out time for. Once you identify an opportunity for improvement during your observations or during your post-outbreak debrief, the QAPI tools can be used to guide your improvement efforts and document your activities using the prioritization worksheet for performance improvement projects or the PIP guide. Using QAPI will help you develop your improvement plan, and we'll have links to those as well in our resources to come. So again, tools and strategies, we talked about using our critical element pathway form as a checklist, doing audits of compliance, and when you find an area that can be improved upon, using those QAPI tools to help with that improvement process. This is a link to that critical element pathway that we talked about. Today we talked about the infection prevention and control and immunization one specifically, but there are 41 critical element pathways that the surveyors use, including the one that we discussed today. So familiarize yourself with each of these and use them as a checklist to prepare for the survey. We talked about those QAPI resources. Missed a slide here. Sorry, a little heavy-handed. Prioritization and the PIP guide. And then we'll have a link in there as well for the World Health Organization. And if I'm just looking back, I really skipped over that slide, or that one did not get in there, so I will send that out after the webinar today. Our next webinar will be our final one in this series. Where can I find additional training for infection prevention and control? I briefly mentioned today the CMS program that will be coming next spring. But most of you really are looking for something prior to that, so we're going to talk about some options for you as well. So register for that call, and the link is there, as well as on the lsqin.org website. The link for the evaluation for today's call is there on your screen. Once that evaluation is completed, you will receive a certificate of attendance that you can print for your records. We will open it up for questions. So you can either put them in the chat box, or Sylvia, our operator for today, can remind us how you can call in with a live question.
Thank you. We will now begin the question and answer session. If you have a question, please press star, then 1 on your touch-tone phone. Once again, that is star 1.
So I see one question in the chat box about where to find past PowerPoints. So the past PowerPoints and the recordings will be on the same website, lsqin.org website, where you registered for the calls. Shortly after each call, they will be posted there. I believe up to call 3 for sure, and maybe 4 is already posted there, both the slides and the recording, so that you can listen to it if you missed it, or so that other staff, perhaps, that you think it would be helpful for can listen as well. Our state surveyors asking to see the audits that we are doing. Again, the situation might be a little bit different, but I would say certainly if surveyors are seeing that there are issues and problems that they're seeing, they are likely to ask you, really, did you notice this was an issue? What kind of audits have you been doing? What kind of improvement efforts have you been doing? They want to see that you are on top of these issues. It shouldn't come as a surprise to you, that your staff is not doing very well at, say, PPE usage or hand hygiene compliance. So good question. Any other questions? there anybody on the line that's been recently surveyed that would like to give us any insight in how it went for you? So the question in the chat box, what level of citation is the most common? And as I said previously, the infection prevention and control ones typically do not reach the immediately jeopardy level. It will vary a little bit from there depending on what they're seeing and how much of it they're seeing. So that is kind of how that process works. And Jenna, could you put the link for the eval in the chat box? Someone is having trouble with it from the slide. So you will see a link to the evaluation in your chat box. Let us know if that is working. How often do glucometers need to be disinfected if every resident has their own individual glucometer? So again, look at your manufacturer directions. That is always your first guide to how something should be handled as far as equipment. The manufacturer of that piece of equipment is required to give you those cleaning and disinfection directions, whether it's for a glucometer, whether it's for an Apollo tub. That is something that they are required to give to you. Now, sometimes that takes a little push and shove from your end for you to get it, but that should come from them. They should be telling you what types of products to be used, how often it has to be done, as well as how it is to be done. Someone put into the chat box that they had a survey at the beginning of March, fairly recently. The infection control person was interviewed for 1.5 hours. They asked to see their infection log, a facility map, and the 5 residents for influenza and pneumovax immunization. An example line list for infections and or symptoms, I had put that in one of the earlier webinars that we did. I believe that would have been the first one on surveillance, and then there was a link in the outbreak one as well. You can certainly email me if you did not get those, and I can forward that to you as well. You might also check your Department of Public Health. Sometimes each state has a sample one that they have put out. And again, think of that as a starter. You want to at least have that much information on your list, and you want to add to it if you are seeing things that are either frequent in your facility or that have come up in your facility assessment, your risk assessment. Any other questions you might have on the most common types of citations as related to infection prevention and control program? The link for the evaluation as well as the handouts has been put into the chat box again. I see some people are having trouble with it. Somebody else with a recent survey said that they were interviewed for about 45 minutes or so. They wanted to see, the process and what you do with that information. Again, not just enough to collect surveillance data, but what do you do with it? Another participant states that they had a large outbreak of norovirus and they never even looked at or asked about it. My guess is from everything else that they saw, they felt that you had done a good job, as with most things when you're being surveyed. If they are seeing that you have the appropriate processes in place, they are not going to ask for, as much of the detail essentially in the log work. So CMS had resurveyed a facility. They were looking at documentations of audit. It is not enough to spot check this participant is sharing. You do need to have documentations of audits. Should include the employee, the date, and the results. All facility employees should be trained or retrained in hand hygiene as needed from what your observations are showing you. So some questions about food service citations, and that can, of course, cross over with our infection prevention and control program. That is another critical element pathway that you want to take a very close look at. When is the last date that we offer influenza vaccine for new residents? So I would really have you check with your department, your Division of Public Health for your state. Every year, as you know, the influenza season can vary a little bit. We used to think, the classic season was kind of October 15th to March 15th. The recent numbers that I've seen, at least coming from the Wisconsin Department of Public Health, is that it is declining, but there still is quite a lot of influenza out there. So I would have you check with your Division of Public Health and see what they're recommending due to what that they are seeing. One participant is noting that they did get a cite for a fluid handler that removed gloves and did not perform hand hygiene and put on another pair. Again, glove use and hand hygiene across the facility. If you're removing your gloves, whether you're getting ready to put another pair on or not, hand hygiene has to be performed. The critical element or critical pathway link, if we can get that into the chat, we will. That was on one of the previous slides. Do you know of any citations that they are receiving in relation to antibiotic stewardship? I think that as a whole what I'm hearing is that surveyors know that you are in the beginning stages, if you will, of antibiotic stewardship. But at a minimum, by this point, and that was really part of phase 2, should have been completed by, November of 2017. You should at least have a committee that's functioning. On that committee, you want to at least have your medical director, some pharmacy involvement, and some of your key clinical people. You want to make sure that you're at least tracking the amount of antibiotics that you're using in your facility. Your pharmacist should be able to give you that. Once you get into your program more, you should then start to sort of expand that, look at which classes of antibiotics are you potentially overusing. Are you using too many fluoroquinolones? Again, your pharmacist is a key, really, member of that antibiotic stewardship committee to start looking at that kind of data. Another participant notes that you want to make sure in your glove policy that you're listing hand hygiene after removal. They really want to make sure that you are teaching your staff appropriately. One participant shares that the last day for flu shots for them is the date that the vaccine expires. Typically, you can't order it after that, so another good point. Where can I find additional audit tools to use for infection prevention? Again, you can email me if you haven't been able to find any. APIC, the Association for Professionals in Infection Control, has some good audit tools. I know that Wisconsin Division of Public Health, their long-term care page certainly has some great audit tools as well. But if you're not able to find anything, again, we did have an audit tool. I didn't include that audit tool in one of our previous webinars. So you can email me if you haven't been able to find it. CDC even has some audit tools, especially for hand hygiene. WHO, World Health Organization, has another great audit tool for hand hygiene as well. Asked some very good questions today. Are there any other questions? You can either put them in the chat box or you can do it live on your phone. Sylvia, could you remind our participants once more how to put in a question on the phone line?
Once again, if you have a question, please press star, then 1 on your touch-tone phone. No audio questions.
Thank you. Okay, if you think of questions after today's call, my email is there. We'll try to then answer them on our call on April 17th. And all the Q&As will be compiled into a document, and that will also be on our website at the conclusion of our 6-call series. That'll be another great place to get that information. The link for the email has been put into the chat box again. Please complete that evaluation. Not only do we find that information very helpful, it helps us design additional webinars. We want to know what it is that you're looking for, how well we're meeting our needs, but that will also get you the certificate of attendance that you can print. That certificate of attendance will pop up at the end of completing that evaluation, and you will be able to print it right from your computer. Please contact me if you have any trouble with that, and we can certainly get you that certificate if for some reason you bypass it and don't get that printed. Yes, go ahead and email me if you miss that step of printing your certificate. But please complete that evaluation using the link provided there so that we can capture your feelings and your suggestions for improving our calls. Do you have any other questions from our participants today?
No questions in audio.
Thank you. If you're having trouble with the link for the eval, I know it's been placed in the chat box a couple of times. If not, email me. Perhaps my emailing it directly to you will work. I don't know really why you're having trouble with it, but they did put into the chat box as well the handout link. So can you discuss what training options might be available? And that actually is, as I said, the subject of our next call in 2 weeks. So if we can just back up a slide here, we want to make sure that you're registering for webinar number 6. And I'll be going over at that time really everything I've been able to find for additional training for now, that they'll be sort of accepting until CMS releases theirs. We know that it'll be at least spring of 2019. Past history shows that sometimes CMS is later than they think they might be. So, we need to do something in the meantime to get you ready for survey as well. So, as soon as that is released, we'll certainly let you know. In the meantime, I will be going over other avenues on our next webinar call. somebody is having trouble with the link for registration for call 6. You can also find that on our lsqin.org website. So if you're having trouble with it from the call today, why don't you try going right to the website. We did post it in the chat box again for you to try. You might try copying it and pasting it, perhaps clicking on it doesn't work on your computer for some odd reasons. If we only knew why computers choose to be bucky when they do, but we'll try and give you a few options to help you out with it. If all else fails, pop me an email. We'll make sure that you get the link for the eval so that you can get the certificate of attendance. We did put the evaluation link in the chat box one more time. Again, try copying it and pasting it. Come out of this webinar, go to your web access and try pasting it in, see if that works for you. I apologize. It seems like a lot of folks are having trouble today. I'm not really sure why. The evaluation should pop up when you close out of the webinar today. Just give a minute or two for any more or additional questions that you might have thought of before we close out today's call. Everyone's experiencing this great spring weather. We hope that our weather improves by our next call in 2 weeks. Maybe we'll be past all this leftover snow and freezing rain and on to spring. Thank you for attending today. Please again complete that evaluation so that you can get your certificate of attendance. And I thank you for attending. We will now discontinue today's call.